Namaste. I'm Dr. Himagirish Rao. I'm an endocrine surgeon. So, a lot of our work involves operating on people with thyroid problems. So, this is a public relations offensive and an initiative on the occasion of World Thyroid Day that falls on the 25th of May every year. So, this is an attempt to spread some public awareness about thyroid and its problems. Surgery is one of the treatment modes that is required sometimes for thyroid disease. Now, which are the patients which need to be operated? These are the patients with nodules. Nodules are little growths that occur in the thyroid gland. So, most of the time, more than 90% of the time, a nodule is benign. That means it is harmless. But 10% of these nodules are malignant or cancer-like. So, when do we operate? So, we operate on patients with thyroid nodules when the nodules are big or when they are growing or when there's likelihood of a cancer or when there's an actual diagnosis of a cancer. When you go to your primary doctor and your primary doctor notices that there's a prominent swelling in the neck, they will tell you that it could be thyroid and they will advise you to undergo some tests. So the basic tests being an ultrasound examination of the neck, just like the way we put the ultrasound probe on the abdomen to look at abdominal problems, maybe gallstones, or pregnant ladies who regularly get ultrasound not for their problem but to follow up the pregnancy. The similar probe will be put on the neck and the thyroid will be evaluated. And if there's a nodule, we will know. Following that, your doctor will advise that you undergo a needle test wherein they will stick a needle into these nodules to look at what the nodules are like and to get at a diagnosis. That is when the needle test tells you that it could be cancer or it could be suspicious of cancer. Or on serial ultrasounds, if we find that the nodules have been growing, these are the times when people advise you to get thyroidectomy or thyroid surgery done. Sometimes what happens is that the thyroid nodule gets too big and it starts growing into the chest. This is another indication when thyroidectomy needs to be done. Now, surgery itself is something that is not very welcome to any patient. We agree. But if that is the only treatment, then I guess it's best to go and get it done. Is it safe? Overwhelmingly so. It's one of the safest procedures around. The general risk of complications or serious complications after thyroidectomy is probably about 2%. People will be concerned with voice change. And although they don't know it, there's changes in the calcium metabolism of the body after thyroidectomy. Sometimes, again, about 1 to 2% of the time. So these are the things that people need to be concerned about. There are various standard operating procedures which thyroid surgeons perform to make sure that these complications do not happen and that the risk of these complications are low. Overall, thyroid surgery is something that is very safe and it's perfectly okay to get it done if there is an indication for thyroid surgery. Thank you.
तस्य भास सर्वमिदं विभाति